I'm very pleased to introduce Trudy Flynn. She is the current chair of the board of directors at the Fibromyalgia Association of Canada. Trudy is a medically retired nurse who has lived with fibromyalgia for over 30 years and was also a caregiver to her daughter, who was diagnosed with fibromyalgia at the age of 8. Trudy is a dedicated advocate for patient-centered care. She's an experienced patient partner in health research, and her first research involvement was with the James Lind Alliance project on the top 10 priorities for adult fibromyalgia patients in 2012. This project opened the door to numerous research opportunities in the years that followed. With a strong belief in the power of lived experience, Trudy champions patient engagement to ensure diverse perspectives are represented in research and decision-making. In 2021, recognizing the absence of a national organization dedicated solely to fibromyalgia, Trudy helped to establish the Fibromyalgia Association of Canada. Before this, fibromyalgia was often treated as an add-on to other conditions. The FAC is a nationwide organization led by people with fibromyalgia for people with fibromyalgia.
I'm grateful for the opportunity to collaborate with Migraine Canada, as fibromyalgia and migraines share many similarities. I have faced the challenges of fibromyalgia and migraines for over 30 years, and my family has been deeply affected by fibromyalgia as well. My daughter, as Kelly said, was diagnosed at the age of 8 with fibromyalgia, and now, many years later, is just starting to develop migraines. And my grandson began experiencing symptoms of fibromyalgia at the age of 6. Now at 18, he is still struggling to get a diagnosis because his doctor is reluctant to label him. And to me, this underscores the urgent need for greater education and awareness. So Fibromyalgia Association Canada is, or like as we like to call it, FAC, is a national organization dedicated to supporting individuals living with fibromyalgia. And we do this through advocacy, education, awareness, and research. FAC works to connect people with resources to improve their quality of life. By fostering a strong community and collaborating with healthcare professionals, FAC strives to enhance understanding and recognition of fibromyalgia across Canada. So between 55 and 80% of people with fibromyalgia also experience chronic headaches, which also include migraines. And that migraines in people with fibromyalgia often tend to be more frequent and more severe. So it's common knowledge in the research community now that these two conditions often occur together. So a 2019 retrospective cohort study analyzed data from 2 populations and found a bidirectional association between fibromyalgia and migraines. Patients with fibromyalgia had a higher incidence of developing migraines and vice versa. And so what is a retrospective cohort study? It is a type of observational study where researchers look back at existing data to analyze outcomes within a specific group or cohort. And the study identifies participants based on past exposures or characteristics, and then examines their medical records or databases to determine how these exposures influenced health outcomes over a period of time. So explain that better with the fibromyalgia community. If you were looking at a study on fibromyalgia and migraines, researchers might analyze medical records from patients diagnosed with fibromyalgia to see how many went on to develop migraines. And they compare that to a control group of people without fibromyalgia. So what is fibromyalgia? Fibromyalgia is a very complex medical condition that primarily involves chronic widespread pain in one or more of the body one or more parts of the body. It's also characterized by unrefreshing sleep that leads to physical exhaustion and cognitive difficulties. So an important point here is that fibromyalgia affects everyone differently, which greatly adds to the complexity of getting diagnosed and treated. Fibromyalgia pain is pain that is ongoing and it lasts longer than 3 to 4 months and can vary in intensity depending on each individual. The pain can be bone pain for one person with fibromyalgia or muscle pain for another person. The pain can wax and wane and move around the body. So what starts as shoulder pain in the morning can end up being hip pain by evening. The pain and location can change rapidly and is very unpredictable. This differentiates fibromyalgia pain from chronic pain like low back pain because low back pain doesn't move. So fatigue is a huge part and it's a huge problem for those of us with fibromyalgia, and it can hit suddenly. This fatigue can be a result of the unrefreshing or non-restorative sleep that many of us have, which actually means you can sleep all night and you wake up feeling like you haven't slept at all. Other people with fibromyalgia have difficulties falling asleep or staying asleep, even though they're exhausted. So people with fibromyalgia can suffer from cognitive issues, which can result in problems with concentration or can actually be memory issues. So those of us with fibromyalgia call this brain fog, and it can be a very serious condition. So brain fog was actually the reason I had to medically retire. I was a nurse and I could not remember if I had given medications, if I had done treatments. And fortunately, at the time, I was working with another nurse who could tell me if I had or hadn't. But I knew I was not going to be able to stay working that way. And in the end, I had to medically retire. It was dangerous for both my patients and for me because it took me so much energy to remember even the smallest things. So this slide is just a few of the symptoms that people with fibromyalgia live with every day. There actually is a list of 200 coexisting symptoms and comorbidities that people with fibromyalgia can have, but not everyone will have these symptoms or conditions. And if you notice, migraines are on that list. The thing is that people with fibromyalgia are so different. So my daughter and I share some of these symptoms. And of course, we share the major ones like chronic widespread pain, brain fog, and the fatigue. But her pain is usually muscle pain, and my pain is usually bone pain. I have dry eyes, and she doesn't. She has brittle nails and hair loss, and I don't. So this is why this condition is so difficult because people are so different. And the important thing here is that it makes it difficult both for us to recognize what's related to fibromyalgia and what isn't. And it makes it difficult for our healthcare providers to do that as well. So the important thing for clinicians here is to learn the main symptoms of fibromyalgia, how to diagnose this condition, and once your patients are diagnosed and they come to you with these unusual symptoms, don't brush them off. Do the research. You can find this list of 200 symptoms and comorbidities on the FAC website. So some 3 facts I'd like to tell you about with fibromyalgia. And these are important facts, but remember, these are not causes of fibromyalgia. This is just facts for those of us living with it. So fibromyalgia is a central nervous system dysfunction. So fibromyalgia is increasingly being recognized as a neurological condition that affects sensory processing and pain regulation in the central nervous system. Research, including work by Dr. Daniel Claw, a leading fibromyalgia researcher from the University of Michigan, suggests that fibromyalgia is a disorder of central sensitization, which means the brain and the spinal cord process pain signals abnormally, leading to heightened pain perception. So key points in his research that support this are that studies using brain imaging such as fMRIs show that people with fibromyalgia have heightened activity in pain processing regions, supporting its classification as a disorder of central sensitization and as a neurological condition. Something that people with fibromyalgia often have is increased sensitivity, not only to pain, but to temperature, sound, light. And this also supports the idea of a sensory processing dysfunction. So while fibromyalgia was once thought to be a musculoskeletal disorder, it is now understood primarily as a neurological condition affecting pain regulation and sensory processing in the central nervous system. So the second fact is that fibromyalgia is not an autoimmune disease. This is often something that is commonly thought that fibromyalgia is, even by people with fibromyalgia, they think it's an autoimmune disease. So it is true, though, that many people acquire autoimmune diseases once they have fibromyalgia because up to 52% of rheumatoid arthritis patients can have fibromyalgia. But the difference is that unlike autoimmune diseases such as rheumatoid arthritis or lupus, fibromyalgia does not involve tissue damage, which reinforces its neurological basis. And the third, but probably the most important fact, is that fibromyalgia is not a psychological condition. While it was historically misunderstood and sometimes dismissed, and sometimes even still is dismissed as being all in our heads, modern research confirms that fibromyalgia, as I stated above, is a neurological disorder involving central nervous system dysfunction and abnormal pain processing. So while conditions like depression and anxiety are more common in people with fibromyalgia, that's likely due to our chronic pain and the impact it has on our daily lives. Fibromyalgia itself is not caused by mental illness. The physical symptoms are real and are well documented as physiological symptoms, not psychological perceptions. Although stress and emotional health can influence pain levels, as with many chronic diseases, fibromyalgia is a biological condition, not a psychological one. So there are some factors associated with fibromyalgia, and one of those is that it's found mostly in women. And while there's no definitive cause of that, the research is starting to show more and more that it may be related to hormones. An interesting fact was that though I was part of a research project that reached out to the fibromyalgia community, which included all the male support groups and all our FAC members, and out of 150 responses, only 4 were male. So this lack of response makes it very difficult to determine the actual factual numbers of how many men do have fibromyalgia and if they actually experience it differently than women. There may be other reasons why women are more apt to be diagnosed with fibromyalgia, because men tell us that it is more difficult for males to be diagnosed with what doctors see as a female condition. And research has also shown that men are more stoic and they just may not tell their doctors the extent of their pain. So the second factor is that it's common knowledge that most people are diagnosed between the ages of 20 and 50. So doctors relate that if you're outside of those, you couldn't possibly have fibromyalgia, and that's not true. Fibromyalgia is seen at every age, but the majority of the time that the people are diagnosed is between 20 and 50. And that's because doctors are reluctant to diagnose children and they dismiss their pain as growing pains. Another reason is that it can take many years for people to be diagnosed with fibromyalgia. So even though children had symptoms, the delay in the diagnosis pushes them into their 20s before they actually receive that diagnosis. And older adults tell us that it's very difficult for someone over the age of 50 to get diagnosed because their pain is written off as pain due to aging. Because, well, don't we all develop pain as we age? And the answer to that question is no, we don't. The third factor is that people with fibromyalgia often have multiple medical problems. This is true. For example, migraines, rheumatoid arthritis, spondylitis, lupus, Hashimoto's, multiple ME, which is encephalitis, often called chronic fatigue syndrome. So there are many medical conditions that people with fibromyalgia have, and that makes it a complex disease to deal with. So how do you get diagnosed? There's one important point I would like you to remember. Fibromyalgia is not a diagnosis of exclusion, and there is no single test to diagnose fibromyalgia. There are, however, diagnostic criteria, which I will speak to in a moment. And FACT, by the way, has this criteria on our website. So if you are trying to get diagnosed, it's important both you and your doctor become familiar with this criteria because it is important to get a diagnosis. So I also would like to mention before I go into the diagnostic criteria that before diagnosing you with fibromyalgia, your doctors will want to confirm that you don't have some other condition that mimics fibromyalgia, like thyroid disease, rheumatoid arthritis, MS, and ME, to name a few. Your doctor, your family doctor, and it should be your family doctor because that's who we rely on when we have fibromyalgia, will do a medical history and a symptom review. Your doctor should ask about your pain to confirm that it's widespread, both sides of the body, above and below the waist, and has lasted 3 to 4 months. Your doctor should also discuss with you whether you have fatigue, sleep disturbances, cognitive difficulties, and maybe a few questions about other symptoms associated with fibromyalgia. Your doctor should do a physical exam to check for other possible causes of your pain, like arthritis. And just a note here that doctors used to use what we call tender point testing for a diagnosis. And unfortunately, some still do that. But it's no longer considered a criteria for diagnosis because many fibromyalgia patients don't react to tender point testing, which is why they're no longer used. So let's discuss the criteria for diagnosing fibromyalgia. The criteria used is the American College of Rheumatology 2016 Diagnostic Guidelines. And this is how they work. A fibromyalgia diagnosis is made based on symptom severity and widespread pain rather than relying solely on tender points, as I mentioned before. So those key criteria include a widespread pain index, which should be equal to or greater than 7, and a symptom severity score, which should be equal to or greater than 5. Now, a diagnosis can still be made if your widespread pain index is between 4 and 6, if and only if your symptom severity score is equal to or greater than 9. So this means that both the widespread pain and the symptom severity must meet a minimum threshold to be diagnosed, which may sound difficult, but if you have fibromyalgia, it is not difficult to reach those levels. Another criteria of these diagnostic criteria is pain has to be present in at least 4 of the 5 pain regions in the body. And those regions are your left upper region, which is your shoulder, your arm, or your jaw, right upper region, shoulder, arm, or jaw, left lower region, which is your hip, your buttock, or your legs, and the same on your right side. And the 5th area is your axial region, which is your neck, your back, your chest, or your abdomen. So if you've covered all those criteria, the last criteria is that your symptoms must have persisted for at least 3 to 4 months, and you must have had fatigue, brain fog, wake up unrefreshed, and maybe had headaches over that period of time. So that sounds pretty straightforward, and it is. But believe it or not, so many people struggle to get that diagnosis. As I said before, some people don't want to give their patients labels, which does irritate me when I hear that, because fibromyalgia is not a label, it is a diagnosis. Other reasons are some doctors don't know about the diagnostic criteria, or some doctors refuse to use it. Some doctors don't even know what fibromyalgia is, or if they know, they don't believe in it. So you're diagnosed. Now what? We hear from a lot of our community members that that's it, they're diagnosed and nothing else. They may be told that they're going to have it the rest of their lives and that there's no clear treatments or cures. And then doctors wonder why their patients are depressed. And that's not all there is. So getting a fibromyalgia diagnosis can feel overwhelming, yes, but it's also the first step towards managing your symptoms and improving your quality of life. So what should you do when you get that diagnosis? Well, the first thing I would recommend is to learn as much as you can about fibromyalgia, because research has shown that understanding your condition and symptoms can help you control your symptoms and lead to a better quality of life. But I must stress here, make sure the information you're getting about fibromyalgia is credible information. And that's where fact comes in, because we really ensure that anything that goes on our website has been fact checked and researched. So what do? You learn about your fibromyalgia, and then the next thing you should explore are treatment options. So with fibromyalgia, no single treatment works for everyone. So it may take time to find out what works for you best. Some people benefit from medications, others do not. Some people respond better to non-medication treatments, and others do not. So speaking of medications, your healthcare provider might suggest or might prescribe 1 or more medications for your condition. Well, there are only 2 medications formally approved by Health Canada specifically for the treatment of fibromyalgia. And those are duloxetine with the trade name Cymbalta. And that name will depend, believe it or not, on where you live in Canada. Some parts of Canada call it duloxetine. Some parts of Canada call it Cymbalta. The second one is pregabalin with a trade name Lyrica. And again, depending on where you live, will determine which name it goes by. So these 2 drugs each work differently to try to change the pain pathways to reduce fibromyalgia pain. Some doctors order antidepressants at very low doses. And an example of that would be amitriptyline, because they use that to help balance certain brain chemicals to reduce the pain, and it does help improve sleep. Other medications may be considered as well, depending on your individual symptoms. And some of those are gabapentin or low-dose naltrexone. Now, some people on low-dose naltrexone or LDN feel that it really helps their symptoms of fibromyalgia. There isn't any inflammatory property to LDN, and they really feel like it helps their symptoms. But many doctors don't know about LDN in association with fibromyalgia. And so many people from our community cannot get their doctors to prescribe this medication, which is very unfortunate because research over the past 10 years have shown that LDN does appear to be safe and an effective treatment option in patients with fibromyalgia. It takes time to see results from these medications, and the length of time will depend on the individual medication. So, some important facts here are that people with fibromyalgia react to many medications. So, the start low and go slow really applies to any medications we take. So you have to remember that not every medication will work for everyone, and sometimes the side effects outweigh the benefits. I have multi-chemical sensitivities, as do many people with fibromyalgia, so I cannot tolerate medications. Definitely the side effects outweigh their benefit in my case. And a note here is that medications, any medications you take, they must be assessed by your healthcare providers to consider any other medical conditions you might have, any other prescriptions or non-prescription drugs, and any other natural products you might be using. So make sure that you have a pharmacist as part of your team and also your doctor, and make sure you're honest with your doctor and tell them everything that you are taking. So all medications have a positive effect, which is what we want, and they also have a negative effect, which is a side effect. So starting at that low dose and increasing slowly as your body adjusts to the medication can help reduce the negative side effects and allow some people to take these drugs. So many fibromyalgia pain may respond to different non-opioid pain medications, and that response is dependent on the person. So an interesting point here, though, that only 40 to 60% of people with fibromyalgia notice that these drugs decrease their pain. And even in those who do see a decrease, they only experience a reduction of 25 to 40%. So these medications, and I think it's important that people taking these medications know that these medications are not going to make you pain-free. They're going to help your pain, but they are not going to make you pain-free. And the individual's tolerance to a drug, that's what will help determine their ideal dose. And evidence has shown that by combining two drugs that work differently may result in better pain control than when either of the drugs are used alone. And because they can be used at lower doses, this may help to reduce the side effects of the medication. Now, some people prefer to go the non-medication management, or some people have to go the non-medication management of fibromyalgia because of reactions to the drugs. So prioritizing sleep and rest is the number one thing for fibromyalgia. People with fibromyalgia need to create a very consistent bedtime, limit your caffeine, your screens, your stress before bed, and try relaxation techniques to help you fall asleep and stay asleep. Box breathing is very good for this because research has shown that by improving sleep for people with fibromyalgia, you will automatically improve your symptoms. So research has shown that gentle movements and exercise like walking, biking, swimming, stretching can improve fibromyalgia symptoms. The thing here is to pace yourself. And when you choose any type of movement or exercise, once again, don't overdo these activities. And you can apply that start low and go slow approach here, the same as you can with medications. Some people say that cognitive behavior therapy or CBT can help with their pain, and at the very least, it can help them develop coping skills. Other people get no relief from CBT. Mind-body techniques like Qigong, meditation, Tai Chi have also been shown by research to have a positive effect for people with fibromyalgia. Interestingly, massage and acupuncture can help some people with fibromyalgia. And then again, there are other people who can't tolerate it. Flare-ups. We have to talk about flare-ups because they are going to happen. So it is important that, like with migraines, you're prepared for it. You need to recognize what your triggers are, and it could be stress, weather, poor sleep, overexertion, something you've eaten, and you need to manage your symptoms accordingly. So the thing is, you need to know what you can do when you're in a flare. Gentle stretching and heat therapy helps some people, while ice might help others. Relaxation therapy helps, and other people increase their medications. So again, because everyone is different, you need an individualized fibro flare plan. And how you do that is to keep a log of your symptoms and a log of what works and what doesn't work. What doesn't work is as important as what does work. Be sure to have a flare kit ready. Based on your previous flares, you should know what you need in that flare kit. And even if you don't actually have it in there, at least have it written down in a logbook inside your flare kit so you know what you need. Because once the flare starts, you aren't going to remember what happened in the past. I've learned that the hard way. I often have to rely on my family to answer my questions. What did I do last time to get out of this flare? And if they don't know or they can't remember, it's a real struggle. So you really have to take responsibility, and you have to make sure you have your flare kit ready to go. Having a support network really helps. It's important to build a strong support network when you live with fibromyalgia. It can be your family, but it doesn't have to be. Some people find that their families are not very compassionate or understanding because fibromyalgia is invisible, and lots of people don't believe what they can't see. And that includes your doctors. And I know people with migraines, they suffer from the same stigma. So what you need to do is you need to educate your family and friends and let them know what they can do to support you. And if they don't support you, you have to find a community that does, like Fibromyalgia Association Canada or some other fibromyalgia peer support group. There is comfort being around someone who actually understands what you're going through. Don't be afraid to seek counseling. There's no shame in that. When you have a chronic condition like fibromyalgia or migraines, you really need to take care of your mental health. Something that's important when you have fibromyalgia is that you have to learn how to say no without guilt. And you have to learn how to set limits. And I have to admit, I am not very good at that. But I try to remember that people without fibromyalgia have to cancel appointments and social events all the time, and no one thinks anything of it. So why should people with fibromyalgia be different? It's far better to cancel something than to put yourself into a flare, because flares are hard to get out of. So when you have a condition like fibromyalgia or migraines, it's important that you learn to advocate for yourself. and that's not always easy. So whether you're seeking workplace accommodations or dealing with the healthcare system, being able to advocate and speak up for yourself is really important. And if you find that difficult, maybe having someone along with you that can advocate on your behalf, if that's the answer, then that's the answer. So if you have other health issues and you have to go to an emergency room, you can be put in a very difficult situation. Emergency rooms are often overwhelming and dismissive for people with fibromyalgia, as the invisible nature of the condition leads to skepticism from healthcare providers. That's just a fact. The bright lights, the long wait times, and sensory overload can worsen your pain and fatigue, making the experience even more distressing. Many people with fibromyalgia report feeling invalidated or gaslit, with their pain attributed to anxiety or actually being dismissed due to a lack of a visible injury. Many people with fibromyalgia actually refuse to go to the emergency rooms, and that's not a good thing because that can create other larger health problems in the future. So, final thoughts is fibromyalgia is real, and while there's no cure, many people find ways to live well with it. Be patient with yourself. Experiment with different strategies, medications, and or alternative therapies. It's important to find out what works best for you and don't expect that to happen overnight. It's a long journey sometimes to actually find what works. Fibromyalgia is a complex condition, but with awareness, support, and research, FAC is working on improving the lives of those affected. Let's continue to advocate, educate, and empower so that no one with fibromyalgia feels unheard or alone. And I really stress that, and I really want to thank Migraine Canada again for inviting me to do this presentation, because this is how people learn about fibromyalgia. This is how people realize what they can do if they think they have fibromyalgia. So thank you again for inviting me to do this presentation,